Stop wasting time on doctors. You're not even that sick. That's what my brother Adrian said as he deleted every single one of my medical appointments from my phone calendar. Like my chronic pain was just drama I needed to get over. My name is Naomi Ferrow, and from wherever you're watching this, stay with me. Because that day, I realized something devastating. I wasn't his sister. I was his burden, his inconvenience, someone whose suffering he could just delete with a swipe. For years, Adrian treated my health issues like they were fake, attention-seeking, a waste of everyone's precious time. He'd roll his eyes when I mentioned doctor visits, mock my medications, tell family I was being dramatic again. But here's what he didn't know. While he was busy dismissing my pain, I was quietly becoming an expert in the very thing that would save his life. Because when addiction finally caught up with my brother, guess who he came crawling back to? The sister whose medical appointments he thought were so pointless. Before we jump back in, tell us where you're tuning in from. And if this story touches you, make sure you're subscribed. Because tomorrow, I've saved something extra special for you. I was 24 when I discovered my brother had been sabotaging my healthcare for months. The realization hit me like a freight train on a Tuesday morning when I called Dr. Morrison's office to confirm my appointment, only to be told I had personally canceled it 3 weeks ago. Then I checked my calendar app and saw the deletion history. Every single medical appointment I had scheduled over the past 6 months had been systematically removed by someone with access to my phone. That someone was Adrian Vosler, my older brother by 3 years, who lived in the same cramped apartment in downtown Millbrook Heights because neither of us could afford rent alone. Adrian, who had convinced our family that my chronic pain condition was psychological, that my fatigue was laziness, that my doctor visits were just expensive therapy sessions for someone who couldn't handle real life. Stop wasting time on doctors. You're not even that sick, he said when I confronted him that morning. He was sitting at our kitchen table, eating cereal like he hadn't just admitted to medical sabotage, like deleting someone's health care was as casual as clearing browser history. You spend more time in waiting rooms than actually living your life, Naomi. Someone had to intervene. I stared at him, phone trembling in my hands, scrolling through months of deleted appointments. Dr. Morrison for pain management, Dr. Patel for blood work. The rheumatologist consultation I had waited 4 months to get. The physical therapy sessions that had actually been helping. All gone. All dismissed as unimportant by someone who had never experienced a single day of chronic illness in his perfectly healthy body. You had no right, I whispered. But Adrian just shrugged. I had access to your phone because you asked me to help you set up that banking app. I saw how much money you were throwing away on medical bills, how much time you were wasting feeling sorry for yourself. I did you a favor. A favor. That's what he called sabotaging my healthcare. That's what he called taking control of my medical decisions without my knowledge or consent. That's what he called months of pain going untreated because I thought I was losing my mind, missing appointments I was certain I had scheduled. This wasn't the first time Adrian had dismissed my health problems, but it was the first time he had actively interfered with my medical care. For years, he had been telling our family that I was exaggerating my symptoms, that chronic fatigue syndrome wasn't a real condition, that my joint pain was psychosomatic. When I would mention a doctor's appointment, he would roll his eyes. When I took medication, he would make comments about drug dependence. When I had to cancel plans because of a flare-up, he would suggest I was using my illness as an excuse to avoid responsibilities. Our parents, Casper and Elena Vosler, had always trusted Adrian's judgment more than mine. He was the successful one, the charming one, the one who could do no wrong in their eyes. When Adrian started suggesting that maybe I was being a hypochondriac, they began to question my medical needs too. When he said I was doctor shopping for attention, they started asking why I needed so many specialists. When he claimed I was addicted to pain medication, they began monitoring my prescriptions. The truth was, I had been diagnosed with fibromyalgia and chronic fatigue syndrome after years of testing and specialist consultations. These weren't imaginary conditions or psychological problems. They were real, documented medical issues that required ongoing treatment and management. But Adrian had convinced himself, and subsequently our family, that I was either faking it for attention or too weak to handle normal life stress. "Look at you," he said that morning, gesturing at me with his spoon. "You're 24 years old, and you act like you're 80. Normal people don't need this many doctors, Naomi. Normal people don't spend half their paycheck on medical bills. Normal people push through discomfort instead of running to specialists every time they feel tired. Normal people." That phrase had haunted me for years. Adrian's definition of normal had become the standard by which my entire family measured. My worth, my legitimacy, my right to seek medical care. If I didn't fit his narrow definition of how a healthy person should behave, then obviously I was the problem. The apartment we shared in Millbrook Heights was small, just 2 bedrooms and 1 bathroom, but it had become my prison. Adrian monitored everything I did, from how long I stayed in bed on bad pain days to how many medications I took. He would comment on my energy levels, my diet, my exercise routine. He had appointed himself as the authority on my health condition, despite having no medical training and no personal experience with chronic illness. "I'm moving out," I told him that morning, my voice steadier than I felt. He laughed. "With what? Money? You can barely afford your share of rent here, and that's with me covering utilities most months. You think you can survive on your part-time income at the bookstore?" He was right about the money. I worked 25 hours a week at Thornfield Books, because full-time employment was impossible with my condition. The fatigue and pain flares made maintaining a consistent 40-hour schedule unrealistic. Adrian worked full-time as a marketing coordinator and never let me forget that he was the primary breadwinner in our shared living situation. But money wasn't the only reason I stayed. Despite everything, Adrian was my family. He was the person who drove me to the emergency room when my symptoms first started. He was the one who helped me research specialists and navigate insurance paperwork in the beginning. Somewhere along the way, though, his initial support had transformed into skepticism, then annoyance, and finally outright sabotage. "You can't keep doing this," I said, trying to keep my voice calm. "You can't make medical decisions for me. You can't delete my appointments. You can't decide what's real and what isn't about my condition." Adrian finished his cereal and put the bowl in the sink without washing it. Another small way he demonstrated his belief that household responsibilities were beneath him. "Watch me," he said simply. "As long as you're living here, as long as you're dependent on me, I'm going to keep protecting you from yourself. Someone has to be the adult in this situation, protecting me from myself." That's how he justified months of medical sabotage. That's how he rationalized taking control of my healthcare decisions. That's how he explained away the fact that he had systematically undermined my relationship with my doctors and delayed necessary treatment. I spent the rest of that day calling medical offices, trying to reschedule appointments that had been canceled weeks or months ago. Some doctors had already filled those slots. Others had wait lists that stretched into the following year. The rheumatologist's office informed me that after missing my consultation, I had been removed from their patient list and would need a new referral to be seen again. That evening, I sat on my bed and made a list of everything Adrian had cost me. Not just the money from missed appointments and rescheduling fees, but the treatment delays, the medication adjustments that had been postponed, the physical therapy progress that had been interrupted. The impact of his intervention would ripple through my healthcare for months. But as I wrote down each consequence of his actions, something else began to crystallize in my mind. Adrian had shown me exactly how much power someone could wield over another person's medical care. He had demonstrated how easily healthcare could be weaponized, how vulnerable patients were to manipulation and control. He had also revealed something about himself that I had been too close to see clearly before. Adrian wasn't just dismissive. of my medical needs. He was actively threatened by them. He couldn't tolerate the idea that someone he saw as weaker than himself might require specialized care that he didn't understand. He couldn't accept that there might be aspects of human health that couldn't be solved through willpower and positive thinking. Most importantly, he had underestimated me completely. Adrian saw someone dependent on medical care and assumed I was dependent on everything else too. He saw someone who needed help managing a chronic condition and decided I was incapable of managing anything else in my life. That night, as I lay in bed listening to him watch television in the living room, I made a decision that would change everything. I wasn't going to waste energy trying to convince Adrian that my medical condition was real. I wasn't going to beg for his understanding or approval. Instead, I was going to become the kind of person who could never again be dismissed, undermined, or sabotaged. I was going to learn everything there was to know about healthcare, about patient advocacy, about medical systems and insurance navigation. I was going to become so competent, so knowledgeable, so undeniably expert in these areas that no one would ever again question my medical decisions or treat my healthcare as optional. And maybe, someday, Adrian would find himself in need of exactly the kind of expertise he was so eager to dismiss. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Growing up in the Vossler household meant living in Adrian's shadow, but it took me years to understand that the shadow was intentionally cast. Our parents, Casper and Elena, didn't accidentally favor Adrian over me. They made deliberate choices, again and again, that communicated exactly where their priorities lay. When Adrian wanted guitar lessons at age 10, our parents immediately enrolled him in weekly sessions with Maestro Valdez, the most expensive music instructor in Pinehurst Valley. When I asked for piano lessons that same year, they bought me a $20 keyboard from a garage sale and suggested I teach myself using YouTube videos. When Adrian's guitar teacher recommended he audition for the youth orchestra, our parents rearranged their work schedules to drive him to rehearsals twice a week. When my elementary school music teacher said I had natural rhythm and should consider formal training, our parents smiled and forgot to mention it at dinner. The pattern extended far beyond extracurricular activities. Adrian got his own bedroom when he turned 12 because he needed space to focus on his studies. I shared a room with our cousin Celia Damari when she lived with us for 6 months, then continued sleeping on a daybed in the converted den until I moved out for college. Adrian's room had built-in shelves, a desk by the window, and walls painted, his favorite color. My space had whatever furniture couldn't fit anywhere else, and a curtain for privacy. When Adrian struggled with algebra in 8th grade, our parents hired a private tutor who came to the house 3 times a week. When I struggled with chemistry in 10th grade, they told me to form a study group with classmates and figure it out. The tutor cost $40 per session. The study group cost nothing and taught me that I was expected to solve my own problems. Medical care followed the same discriminatory pattern long before Adrian started actively sabotaging my appointments. When Adrian broke his arm during a soccer game in 9th grade, our parents rushed him to the emergency room and insisted on seeing an orthopedic specialist within the week. They researched the best doctors, sought second opinions, and made sure he had physical therapy to regain full strength. When I sprained my ankle during track practice that same year, they gave me an ice pack and told me to walk it off. The sprain never healed properly, leaving me with chronic instability that still affects me today. Adrian's sports injuries were always taken seriously. Mine were dismissed as growing pains or clumsiness. Adrian's complaints of headaches led to comprehensive testing and a consultation with a neurologist. My complaints of joint pain and fatigue were attributed to stress, poor sleep habits, or not eating enough vegetables. The financial investment in Adrian's well-being was staggering when I actually calculated it years later. Private tutoring, music, lessons, sports equipment, medical specialists, summer camps, college prep courses, SAT coaching, application fee support for 12 different universities. My education funding consisted of community college tuition assistance and a suggestion that I work part-time to cover my own expenses. Even our achievements were measured on different scales. When Adrian made the varsity soccer team as a junior, our parents threw him a celebration dinner and invited extended family to hear about his athletic accomplishments. When I made the honor roll every semester of high school, they said, "That's nice, honey," and moved on to discussing Adrian's college prospects. When Adrian won a regional guitar competition, they put the trophy on the mantelpiece and took out an ad in the local newspaper announcing their pride. When I won a state-level writing contest, they hung the certificate on the refrigerator next to grocery lists and expired coupons. The messaging was clear and consistent. Adrian's successes mattered more than mine. Adrian's problems deserved immediate attention and resources. Adrian's future was worth investing in. My accomplishments were expected rather than celebrated. My struggles were character-building opportunities rather than situations requiring support. This disparity became even more pronounced when I started developing symptoms of what would eventually be diagnosed as fibromyalgia and chronic fatigue syndrome. I was 19 and in my second year of community college when the pain and exhaustion became impossible to ignore. I would wake up feeling like I had been hit by a truck, my joints aching and my muscles tight. Simple activities like carrying textbooks or sitting through lectures became monumentally difficult. Adrian, meanwhile, was thriving in his junior year at Westbridge University, playing intramural soccer and maintaining a social schedule that seemed to require no recovery time whatsoever. When he came home for holidays, he would regale our parents with stories of his busy academic and social life. Late nights studying, weekend camping trips, pickup basketball games, internship applications, job interviews. He moved through life with the kind of energy and resilience that I could barely remember having. The contrast became a source of constant commentary from our parents. Why couldn't I be more like Adrian? Why did I always seem tired? Why was I so focused on physical limitations instead of pushing through challenges the way he did? They began to frame my health struggles as a character deficiency rather than a medical condition. Adrian doesn't let obstacles stop him, our mother Elena would say when I had to miss family gatherings due to pain flares. He finds ways to adapt and overcome. Maybe you should try Adrian's approach to stress management, our father Casper would suggest when I mentioned feeling overwhelmed by work and medical appointments. He stays active and keeps a positive attitude. They meant these comments as motivation, but they felt like accusations. Every suggestion that I should be more like Adrian carried the implicit message that my current condition was a choice, a failure of willpower, a problem that could be solved if I just tried harder or wanted it badly enough. Adrian absorbed these messages and began to see himself as the family authority on health and wellness. He started offering unsolicited advice about my diet, exercise routine, sleep schedule, and stress management techniques. He would send me articles about the benefits of positive thinking and the dangers of focusing too much on medical problems. He genuinely believed he was being helpful, but his advice always carried an undertone of superiority and judgment. "You know what your problem is?" he said during one particularly memorable conversation when I was 22 and still living at home to save money. "You've made being sick into your whole identity. You've convinced yourself that you can't do normal things, so you don't even try anymore." This comment came after I had to cancel plans to attend his graduation party because I was experiencing a severe flare-up that left me barely able to walk. I had been looking forward to celebrating with him and had even bought him a graduation gift that I couldn't afford on my limited income. But the pain was so intense that day that I couldn't stand up for more than a few minutes at a time. Adrian's response wasn't concern or understanding. It was annoyance that my health problems had interfered with his celebration. It was frustration that I couldn't just power through the pain for his sake. It was the assumption that my limitations were self-imposed rather than medically necessary. I'm not choosing to be sick, I tried to explain. But he had already moved on to complaining about how my absence would look to his friends and how he would have to explain why his sister couldn't be bothered to show up for his big day. Our parents supported his interpretation of events. They were disappointed in me for missing Adrian's party. They suggested that maybe if I had planned better, managed my stress more effectively, or maintained a more positive attitude, I could have participated in this important family milestone. The message was always the same. Adrian's needs came first. Adrian's events were more important. Adrian's perspective was more valid. My health problems were inconveniences that interfered with their ability to celebrate and support their successful son. By the time I moved in with Adrian in Millbrook Heights, this dynamic was so entrenched that neither of us questioned it. He naturally assumed the role of authority figure in our shared living situation. I naturally accepted the role of younger sister who needed guidance and supervision. The arrangement seemed practical and mutually beneficial until the morning. I discovered he had been deleting my medical appointments. That's when I realized that the pattern of favoritism hadn't ended when we became adults. It had evolved. Adrian still saw himself as the responsible, capable sibling who knew what was best for both of us. He still saw me as the problematic younger sister who needed protection from her own poor decisions. The difference was that now he had the power to act on these beliefs in ways that directly affected my health and well-being. And he had been using that power for months without my knowledge, convinced that he was helping me become a stronger, more independent person. Looking back, I can see how perfectly Adrian had been trained for this role. Our parents had spent years teaching him that his judgment was superior to mine, that his needs were more important than mine, that his perspective on my health was more valid than my own lived experience. They had created a dynamic where Adrian felt entitled to make decisions for me, and I felt obligated to accept his authority. But they had also created something else, something they never intended, a deep well of determination in me to prove them all wrong. Every dismissal, every comparison, every suggestion that I should be more like Adrian had been building towards something. I just hadn't realized it yet. The appointment Adrian deleted that changed everything wasn't just another routine checkup. It was my consultation with Dr. Hawthorne, the specialist who had finally agreed to see me after 18 months of waiting lists, insurance appeals, and medical referrals. Dr. Hawthorne was one of only 3 doctors in our entire state who specialized in complex chronic pain conditions, and getting on her schedule was like winning a medical lottery. I had been preparing for this appointment for weeks. I had organized all my medical records, written down every symptom and medication reaction, researched Dr. Hawthorne's approach to treatment, and compiled a list of questions about potential therapies I had read about in medical journals. This wasn't just another doctor's visit. It was my best chance at finding answers and relief after years of ineffective treatments. The appointment was scheduled for March 15th, a Thursday morning at 9:30. I had requested the day off work 3 weeks in advance. I had arranged for my neighbor, Mrs. Corrin, to drive me because the consultation was expected to last several hours and might involve procedures that would make driving unsafe. I had even bought a new notebook specifically for taking detailed notes about Dr. Hawthorne's recommendations. On March 14th, the day before my appointment, I received a phone call from Dr. Hawthorne's office. Ms. Ferrow, this is Jennifer from Dr. Hawthorne's office. I'm calling to confirm that you want to cancel your appointment tomorrow at 9:30. I was at work, shelving returns in the fiction section of Thornfield Books, when the call came. For a moment, I couldn't process what Jennifer had said. I'm sorry, what? Cancel my appointment? Yes, you called yesterday afternoon and said you needed to cancel due to a family emergency. Since this was less than 24 hours' notice, there will be a cancellation fee of $250, and you'll need to call back when you're ready to reschedule. Dr. Hawthorne's next available appointment is in November. November, 8 months away. I felt my knees go weak and had to sit down on the floor between the bookshelves. I didn't cancel anything, I said, my voice barely above a whisper. There's been a mistake. I need that appointment tomorrow. Jennifer's tone became more formal. According to our records, someone called yesterday at 3:15 p.m. from the phone number we have on file for you and canceled the appointment. They provided your full name and date of birth for verification. 3:15 p.m. I had been at work until 5 that day, and Adrian would have been home from his marketing job by then. Adrian, who had access to my phone and knew all my personal information. Adrian, who had been increasingly vocal about his belief that I was seeing too many doctors and spending too much money on medical care. "Can you tell me anything else about the phone call?" I asked desperately. "Was it a man or woman who called?" "I'm sorry, but I can't provide additional details about the cancellation. If you'd like to dispute the cancellation fee or discuss rescheduling, you'll need to speak with our office manager, but she's not available until Monday." I hung up and immediately called Adrian. He answered on the first ring, which was unusual because he typically let calls go to voicemail during work hours. "Hey, what's up?" "Did you cancel my doctor's appointment for tomorrow?" There was a pause that lasted too long. "Which appointment?" "Adrian, did you cancel my appointment with Dr. Hawthorne?" Another pause. Then, "We'll talk about this when I get home." "No, we'll talk about this right now. Did you call and cancel my appointment?" "Naomi, you've been obsessing over this appointment for weeks. You've been researching this doctor online, printing out articles, making lists. It's not healthy. You're building up unrealistic expectations about what one more specialist is going to tell you." I was sitting on the floor of the bookstore, surrounded by romance novels, having the worst conversation of my life with my brother, who had just admitted to medical sabotage. "You had no right," I said, but my voice cracked on the words. I had to do something. You were getting your hopes up about some miracle cure, and when this doctor tells you the same thing every other doctor has told you, you're going to be devastated. I was protecting you from disappointment. You were protecting me from disappointment by stealing 8 months of my life? You're being dramatic. There are other doctors. Not like Dr. Hawthorne. Not with her specialization. Not with her research background. Adrian, I waited 18 months to get this appointment. And you can wait 8 more months to get another one. Maybe by then you'll have a more realistic perspective about what doctors can actually do for your condition. I hung up on him. Then I called Dr. Hawthorne's office back and begged Jennifer to see if there had been any mistake, any possibility of squeezing me in, any cancellation that might open up a slot in the next few weeks. She was sympathetic but firm. Dr. Hawthorne's schedule was booked solid, and the November appointment was the earliest possibility. The cancellation fee would be charged to my credit card on file within 48 hours. I left work early that day, claiming a family emergency that wasn't technically a lie. When I got home to our apartment, Adrian was already there, sitting at the kitchen table with his laptop open and a concerned expression that I now recognize as completely performative. "Look, I know you're upset," he began before I could say anything. "But I think when you calm down, you'll realize I was trying to help." Help? I was shaking, not from anger, but from the sheer magnitude of what he had done. "Adrian, that was my best chance at getting answers. Dr. Hawthorne has published research on conditions exactly like mine. She has treatment protocols that other doctors don't know about. She might have been able to help me in ways that no one else has been able to. Or she might have told you exactly what every other doctor has told you, and you would have spent another few $100s to hear the same diagnosis and the same limited treatment options. That wasn't your decision to make." Adrian closed his laptop and looked at me with what I can only describe as pity. "Naomi, you've been to 7 different doctors in the past 2 years. You've had dozens of tests, tried 15 different medications, done physical therapy, acupuncture, massage therapy, dietary changes. Nothing has significantly improved your condition. At some point, you have to accept that this is just how your body works and focus on adapting instead of searching for fixes that probably don't exist. So you decided to sabotage my healthcare to teach me acceptance." I decided to interrupt. a pattern of behavior that was consuming your life and draining your bank account. You spend more time researching doctors and preparing for appointments than you do actually living your life. I stared at him, trying to understand how someone who claimed to love me could rationalize such a devastating violation of my autonomy and trust. "Do you have any idea what you've done?" I asked quietly. "I've given you an opportunity to focus on other things. Maybe now you can put some energy into your job, or social relationships, or hobbies that don't involve medical research." "I've been living in pain for 3 years, Adrian. Every day. Some days I can barely get out of bed. Some days I cry in the shower because my joints hurt so much that washing my hair feels like torture. Dr. Hawthorne might have had solutions that could give me my life back, and she might not have. You were setting yourself up for another disappointment." That was my disappointment to have. Adrian sighed like I was being unreasonable. "You're not thinking clearly about this. You're too emotionally invested in medical solutions to see the bigger picture. Someone who cares about you needed to step in and provide some perspective. Someone who cares about me would have driven me to the appointment and held my hand in the waiting room. Someone who cares about you prevents you from wasting more time and money chasing treatments that probably won't work." The conversation continued for another hour, but it became clear that Adrian genuinely believed he had done the right thing. In his mind, canceling my appointment was an intervention, a necessary action to protect me from my own poor judgment and unrealistic expectations. He saw my pursuit of medical care as an unhealthy obsession rather than a reasonable response to chronic illness. That night, I lay in bed staring at the ceiling and processing the full scope of what had happened. Adrian hadn't just canceled an appointment. He had stolen months of my life by forcing me to wait until November for another chance at specialized care. He had violated my medical privacy by accessing my healthcare information without permission. He had sabotaged my relationship with my doctors by making me appear unreliable and indecisive. Most devastatingly, he had communicated that he valued his opinion about my medical needs more than my own lived experience of illness and pain. I realized that this incident wasn't an aberration or a mistake in judgment. It was the logical conclusion of years of family dynamics that had taught Adrian to see himself as the authority on my life and my needs. Our parents had trained him to believe that his perspective was more valid than mine, that his decisions were more sound than mine, that his judgment was more trustworthy than mine. The appointment cancellation was just the most extreme expression of beliefs that had been building for years. But as I lay there in the dark, listening to Adrian watch television in the living room like nothing had happened, I made a decision that would change the trajectory of my entire life. I was done being the victim of other people's medical opinions. I was done having my healthcare decisions second-guessed by people who had never experienced chronic illness. I was done being treated like a child who couldn't be trusted to manage her own medical care. If Adrian believed that seeking medical treatment was a waste of time, I would prove him wrong by becoming so knowledgeable about healthcare that no one could ever again dismiss my medical decisions as uninformed or unreasonable. If he thought doctors couldn't help people with conditions like mine, I would learn so much about chronic illness and pain management that I could help others in ways their doctors hadn't been able to. And if he ever found himself in need of medical expertise, he would discover that the sister whose healthcare he had sabotaged had become the person he should have trusted from the beginning. After the appointment cancellation, something fundamental shifted inside me. I stopped trying to convince Adrian that my medical condition was real. I stopped seeking his understanding or approval. I stopped sharing details about my symptoms, treatments, or doctor visits. Not out of spite, but out of a sudden clarity about where my energy needed to go. If Adrian wanted to believe I was a hypochondriac wasting time and money on unnecessary medical care, fine. Let him believe that. I would use his dismissal as fuel to become someone whose medical knowledge could never be questioned or undermined. I moved through our shared apartment like a ghost for the next several weeks. Adrian seemed relieved by my silence, Interpreting, it is evidence that his intervention had been successful in breaking my unhealthy obsession with medical care. He made a few attempts at normal sibling conversation, but I responded with polite detachment. I wasn't angry anymore. I was focused. During my shifts at Thornfield Books, I began spending my breaks researching medical programs instead of reading fiction or scrolling social media. The bookstore had a small reference section that included some basic medical textbooks, and I found myself gravitating toward those shelves during quiet periods. I started with simple anatomy guides and gradually moved toward more complex texts about chronic pain conditions, autoimmune disorders, and treatment protocols. Mrs. Alessandra Corin, who owned the bookstore, noticed my new reading habits after about a month. "Getting interested in medicine?" she asked one afternoon as I shelved a copy of Gray's Anatomy that I had been reading during lunch. "Something like that," I replied, not wanting to explain the complicated family dynamics that had led to my newfound passion. "My daughter went to nursing school," Mrs. Corin said. "Started just like you, reading everything she could get her hands on about healthcare. Now she's a nurse practitioner specializing in pain management." The words hit me like lightning. Pain management. A nurse practitioner who specialized in exactly the kind of medical care I had been seeking for years. How long did it take her to complete her education? About 6 years total. 2 years for her associate degree in nursing. Worked as an RN for a couple years to get experience. Then went back for her master's degree to become a nurse practitioner. She loves it. Says there's nothing better than helping people who have been suffering get relief from chronic pain. That conversation planted a seed that grew rapidly in the following weeks. I began researching nursing programs, admission requirements, and career paths for nurse practitioners specializing in pain management. The more I learned, the more excited I became about the possibility of turning my personal experience with chronic illness into professional expertise that could help others. But there were significant obstacles. Nursing school required prerequisite courses I had never taken. The programs were competitive and expensive. Most importantly, I would need to complete my education while managing my own chronic health condition and working enough hours to support myself financially. I started small. I enrolled in one prerequisite course, Anatomy and Physiology BAM at the community college. I chose an evening section that wouldn't interfere with my work schedule at the bookstore. I didn't tell Adrian about the class. I simply adjusted my routine to accommodate study time and homework. The first night of class, I sat in the back row of a lecture hall filled with students who looked like they belonged there. Pre-nursing students with color-coded planners and medical terminology apps on their phones. Pre-med students who spoke confidently about organic chemistry and MCAT scores. I felt like an imposter with my notebook from the dollar store and my highlighters from the bookstore's office supplies. But when Professor Valdez began explaining how the nervous system processes pain signals, I found myself completely absorbed. Every concept she discussed related directly to my lived experience of chronic pain. The difference was that now I was learning the scientific vocabulary to describe what I had been feeling for years. After that first class, I stayed behind to ask Professor Valdez about additional resources for students interested in pain management. "That's a fascinating specialization," she said. "Are you considering nursing or medical school?" "Nursing, I think. Eventually. I'm just taking prerequisites right now to see if I can handle the coursework." Professor Valdez looked at me more carefully. "Have you had personal experience with chronic pain conditions?" I nodded, unsure how much to reveal to someone I had just met. Some of my best students have been people who bring personal experience to their studies. They understand the human impact of medical conditions in ways that can't be taught from textbooks alone. If you're serious about pain management, I'd recommend connecting with the local chapter of the International Association for the Study of Pain. They have monthly meetings where healthcare providers discuss recent research and treatment approaches. I had never heard of the organization, but I wrote down the information and spent that evening researching their upcoming meetings and membership requirements. The monthly meetings were held at Millbrook Heights General Hospital, the same hospital, where I had been treated in the emergency room several times over the past few years. Walking into the conference room filled with doctors, nurses, physical therapists, and researchers felt intimidating, but the presentations were fascinating. I sat in the back and listened to discussions about emerging treatments for fibromyalgia, new approaches to medication management for chronic pain patients, and research studies investigating the effectiveness of various non-pharmacological interventions. For the first time in years, I felt hopeful about the possibility of better treatment options for people with conditions like mine. After the third meeting I attended, Dr. Joanne Hayes, a nurse practitioner who had given a presentation about integrative approaches to chronic pain management, approached me during the networking break. "I've noticed you at the last few meetings," she said. "Are you a healthcare provider?" "Not yet. I'm working on prerequisites to apply to nursing school. I'm particularly interested in pain management because of personal experience with chronic pain conditions." Dr. Hayes nodded thoughtfully. Personal experience combined with professional training can be incredibly powerful. Have you considered shadowing healthcare providers to get a better sense of different career paths in pain management? The idea of shadowing hadn't occurred to me, but Dr. Hayes offered to let me observe her clinic one day a week if I could arrange my work schedule around it. The opportunity to see pain management from the provider's perspective was exactly what I needed to confirm my career direction. Adrian noticed my schedule changes, but didn't ask questions. I think he assumed I was finally taking his advice to focus on activities other than medical appointments. When I stayed out late on meeting nights or adjusted my work hours to accommodate shadowing opportunities, he seemed pleased that I was becoming more independent and less focused on health issues. He had no idea that I was becoming more focused on health issues than ever before, just from a completely different perspective. After 6 months of attending meetings, shadowing Dr. Hayes, and excelling in my prerequisite courses, I made the decision to apply to accelerated nursing programs. The programs were intensive, designed for students who already had bachelor's degrees in other fields, but they offered the fastest path to becoming a registered nurse. I spent weeks on my application essays, describing my personal experience with chronic illness and my commitment to providing compassionate, evidence-based care to patients dealing with similar conditions. I requested recommendation letters from Professor Valdez, Dr. Hayes, and Mrs. Corin, who had supported my educational goals by allowing me flexible work hours. The day I submitted my application to Westbridge University's Accelerated Nursing program, I felt a mixture of terror and excitement. I was applying to attend the same university where Adrian had completed his bachelor's degree, but in a field that would require me to demonstrate exactly the kind of medical knowledge he had, always dismissed as unnecessary. When Adrian asked what I had been so busy with lately, I gave him a partial truth. "I've been taking some classes and doing volunteer work at the hospital." "That's great," he said, seeming genuinely pleased. "I was wondering when you'd start focusing on something other than your medical problems." I didn't correct his assumption. Let him think I was moving away from medical concerns instead of diving deeper into them than ever before. Let him believe his intervention had been successful in redirecting my attention away from healthcare. What he didn't understand was that his sabotage had been the catalyst for the most important decision of my life. By dismissing my medical needs and undermining my healthcare, he had inadvertently pushed me toward becoming the kind of healthcare provider I had always needed but never found. The acceptance letter from Westbridge University's Accelerated Nursing program arrived on a Thursday morning in April. I opened it alone in our apartment while Adrian was at work, and when I read the words, "We are pleased to inform you," I cried with relief and excitement. I was going to become a nurse. I was going to specialize in pain management. I was going to help people who had been dismissed, undermined, and disbelieved, just like I had been. And Adrian, who had tried to protect me from disappointment by sabotaging my medical care, had no idea that his actions had led me toward the most meaningful career path I could have imagined. Accelerated nursing school was like drinking from a fire hose while running a marathon in the dark. Classes ran from 8 in the morning until 6. In the evening, 5 days a week. Clinical rotations started at 5:30 a.m. and often didn't end until late evening. Studying consumed every free moment, and there were precious few of those. I had quit my job at Thornfield Books to focus entirely on nursing school, which meant living off student loans and the small savings account I had built up over the past few years. Adrian offered to cover more of our shared expenses, an offer I accepted with mixed feelings because I knew he saw it as evidence that my previous medical expenses had been unnecessary financial burdens. "See how much money you save when you're not constantly going to doctors?" he said when I explained that nursing school would require me to live more frugally. "Maybe this program will give you some perspective on healthcare from the provider side." He had no idea how accurate that statement would prove to be, just not in the way he intended. I threw myself into nursing school with an intensity that surprised my classmates and professors. While other students struggled to memorize anatomy and physiology concepts, I absorbed the material like a sponge, because I had been living with the real-world applications of these principles for years. When we studied pain pathways and neurotransmitter functions, I could visualize exactly how these processes played out in my own body. My clinical performance was strong from the beginning. I had a natural rapport with patients, particularly those dealing with chronic conditions, because I understood their frustration with healthcare systems that often dismissed or minimized their symptoms. I knew what it felt like to have your pain rated on a numeric scale that didn't capture the complexity of your experience. I understood the exhaustion that came from repeatedly explaining your condition to providers who had already made up their minds about your case. Professor Dahlia Quenrick, who taught our pharmacology course, noticed my particular interest in pain management medications during our unit on analgesics and adjuvant therapies. "Have you considered specializing in pain management after graduation?" she asked, after I submitted a research paper analyzing the effectiveness of multimodal pain treatment protocols. "That's the plan," I told her. "I want to work in a setting where I can really focus on helping patients with chronic pain conditions." With your academic performance and your apparent passion for this area, you should consider applying to nurse practitioner programs after you get some bedside experience. We need more providers who understand the complexity of chronic pain management. The suggestion planted another seed. Becoming a nurse practitioner would allow me to provide more comprehensive care, order diagnostic tests, prescribe medications, and develop treatment plans. It would give me the kind of medical authority that Adrian had always dismissed as unnecessary when applied to my own condition. During my medical surgical rotation, I was assigned to work with Vera Siltrin, a nurse practitioner who ran the hospital's chronic pain clinic. She became the mentor I hadn't known I needed. "I hear you're interested in pain management," she said on my first day in the clinic. "Very interested. I have personal experience with chronic pain, and I want to help other patients navigate the healthcare system more effectively." Vera nodded knowingly. Personal experience can be both a tremendous asset and a potential challenge in this field. You'll have insight that providers without chronic conditions lack, but you'll also need to maintain professional boundaries and avoid projecting your own experiences onto your patients. Working with Vera was like getting a masterclass in compassionate, evidence-based pain management. I watched her conduct comprehensive assessments, develop individualized treatment plans, and advocate for patients whose pain had been dismissed by other providers. She taught me how to balance empathy with clinical objectivity, how to navigate insurance requirements for specialized treatments, and how to document patient care in ways that supported rather than undermined their credibility. Most importantly, she showed me how healthcare providers could empower patients instead of dismissing them. "The most important thing we can do," Vera told me during one of our post-clinic debriefings, "is to believe our patients when they tell us about their pain. So many of these patients have been told their symptoms are psychological, exaggerated, or drug-seeking behavior, When we take their reports seriously and work collaboratively on treatment plans, we give them hope and agency in their own care. I thought about Adrian's dismissal of my medical needs and wondered what my experience would have been like if he had approached my condition with Vera's mindset instead of his skeptical, protective attitude. My academic performance throughout nursing school was exceptional. I maintained a GPA above 3.8, scored in the 90th percentile on standardized nursing exams, and received outstanding evaluations from clinical supervisors. More importantly, I was developing the clinical knowledge and skills that would allow me to provide the kind of care I had always wished I could receive. During my final semester, I applied to work as a new graduate nurse in the chronic pain clinic where I had done my rotation with Vera. The position required excellent assessment, skills, strong pharmacology knowledge, and the ability to work with challenging patient populations. It was competitive, with only 2 new graduate positions available, but Vera had agreed to serve as a reference and had encouraged me to apply. The interview process included a case study presentation where candidates had to develop a comprehensive care plan for a patient with complex chronic pain conditions. I chose to present a case similar to my own experience. A young adult with fibromyalgia and chronic fatigue syndrome who had struggled to find effective treatment and had experienced dismissive attitudes from healthcare providers. My presentation included current research on multimodal treatment approaches, discussion of the psychological impact of chronic pain, and strategies for building therapeutic relationships with patients who had lost trust in the healthcare system. I talked about the importance of validating patients' experiences while maintaining hope for symptom improvement. The interview panel was impressed. Dr. Magnus Trelane, the medical director of the pain clinic, offered me the position on the spot. Your combination of clinical knowledge, research background, and patient advocacy mindset is exactly what we need, he said. When can you start? I graduated from nursing school in December and began working in the chronic pain clinic in January. Adrian attended my graduation ceremony and seemed genuinely proud of my academic achievement, though he still viewed nursing as a more practical and less obsessive approach to healthcare than my previous focus on seeking treatment for my own condition. I'm glad you found a career that lets you channel your interest in medical stuff in a productive way, he said after the ceremony. This is so much better than spending all your time and money trying to find doctors to fix problems that probably can't be fixed. I smiled and thanked him for his support, not bothering to correct his fundamental misunderstanding of what I was doing. Adrian saw my nursing career as a way to move past my medical problems. I saw it as the beginning of my expertise, in exactly the field he had tried to prevent me from pursuing. Working in the pain clinic was everything I had hoped it would be. I provided comprehensive assessments for patients with complex chronic conditions. I educated them about their diagnoses and treatment options. I coordinated care between multiple specialists. I advocated for patients whose pain had been dismissed by other providers. Most rewarding was seeing the relief on patients' faces when they realized that someone finally understood and believed their reports of pain. I could provide validation and hope because I had lived through similar experiences and found ways to manage my condition effectively. After 6 months in the clinic, Vera encouraged me to apply to nurse practitioner programs. You have the clinical foundation now, she said. With your academic record and your passion for this field, you'd make an excellent nurse practitioner. We could use another provider in the clinic. I applied to 3 different nurse practitioner programs, all with specializations in chronic pain management or adult health with a focus on complex medical conditions. My application materials highlighted my clinical experience, research interests, and commitment to improving care for underserved patient populations. The day I received my acceptance letter to the nurse practitioner program at Westbridge University, I was working a late shift at the clinic. I read the email on my phone during my break and felt the same mixture of excitement and disbelief that I had experienced when I was accepted to nursing school. I was going to become a nurse practitioner. I was going to have prescriptive authority, the ability to order diagnostic tests, and the clinical autonomy to develop comprehensive treatment plans for patients with conditions exactly like my own. Adrian still lived in our shared apartment, still worked his marketing job, and still viewed my healthcare career as a healthy distraction from my previous medical concerns. He had no idea that I was becoming exactly the kind of healthcare provider whose expertise he had always dismissed as unnecessary. But I was beginning to realize that his dismissal of my medical knowledge was going to become a problem for him, sooner than either of us expected. During my lunch breaks at the clinic, I had started noticing troubling patterns in Adrian's behavior when I saw him briefly at home. He seemed more tired than usual, more irritable, and less interested in the social activities that had always been central to his identity. When I asked if he was feeling okay, he brushed off my concerns with the same dismissive attitude he had always used regarding health issues. "I'm fine, Naomi. Not everyone needs to see a doctor every time they feel a little run down." But I was learning to recognize the early signs of various health conditions, and some of Adrian's symptoms were raising red flags in my newly trained clinical mind. I wondered what would happen when Adrian finally needed the kind of medical expertise he had spent years dismissing as unnecessary and wasteful. Had a feeling I was going to find out sooner rather than later. 2 years into my nurse practitioner program, I made a decision that would prove more prescient than I could have imagined. I chose to focus my clinical specialization on dual diagnosis, treatment, the intersection of chronic pain management and substance use disorders. It wasn't a popular choice among my classmates, who gravitated toward more mainstream specializations like family practice or women's health, but my experiences had taught me that pain and addiction were often interconnected in ways that most healthcare providers didn't fully understand. The specialization required additional clinical hours at Millbrook Heights Recovery Center, a comprehensive treatment facility that addressed both physical and psychological aspects of substance use disorders. Dr. Celine Caraway, the medical director, had developed innovative protocols for treating patients whose addiction had originated from legitimate pain management needs, people who had been prescribed opioids for chronic conditions, and gradually developed dependence. "This is some of the most challenging work in healthcare," Dr. Caraway warned me during our orientation meeting. "These patients are dealing with multiple complex conditions simultaneously. They need pain relief, but they also need addiction treatment. Many providers don't feel comfortable managing both aspects of their care." I found the work fascinating rather than intimidating. My personal experience with chronic pain gave me insight into how easily patients could become dependent on medications that provided their only relief from suffering. My professional training taught me how to distinguish between appropriate medication use and problematic patterns of consumption. More importantly, I was learning to recognize the early signs of substance use disorders, even when patients were skilled at concealing their behavior from family members and healthcare providers. During this time, Adrian's behavior at home was becoming increasingly concerning, though he dismissed my observations whenever I expressed worry about his health. He was staying out later, often coming home after midnight on weeknights with explanations about work events or social obligations that seemed inconsistent with his previous patterns. His sleep schedule became erratic, and he frequently called in sick to work with vague complaints about stomach issues or headaches. Most troubling was his new relationship with alcohol. Adrian had always been a social drinker, someone who enjoyed beer with friends or wine with dinner, but his consumption patterns were changing dramatically. I would find empty bottles hidden in unusual places around our apartment, behind books, on shelves under bathroom sinks, in closets behind winter coats. When I asked him about the increased drinking, he became defensive and angry. "I'm dealing with a lot of stress at work right now," he said when I mentioned finding a vodka bottle in his bedroom closet. "Maybe if you weren't constantly analyzing everything I do like I'm one of your patients, I could relax in my own home." The irony wasn't lost on me. Adrian, who had spent years dismissing my medical concerns as dramatic overreactions, was exhibiting classic signs of substance use disorder while simultaneously rejecting any suggestion that his behavior might indicate a health problem. but I was no longer the naive sister who had been hurt by his dismissal of my chronic pain condition. I was a healthcare provider trained to recognize the signs and symptoms he was displaying, and everything I was seeing pointed toward a serious problem that would require professional intervention. My clinical rotation at the recovery center had taught me that family members were often the last to acknowledge addiction problems, even when they had healthcare training. Denial was a powerful psychological defense mechanism that allowed people to continue destructive behaviors while maintaining the illusion that they were still in control. Adrian's denial was textbook perfect. He had explanations for every concerning behavior, justifications for every change in his routine, and anger toward anyone who suggested that his drinking might be becoming problematic. When our neighbor, Mrs. Corrin, mentioned that she had heard loud music coming from our apartment at 3 a.m. on multiple weeknights, Adrian claimed I was exaggerating the frequency of his late-night activities. Naomi has always been dramatic about everything, he told her. She's studying addiction now, so she thinks everyone around her has a problem. The comment stung because it revealed that Adrian still saw my medical knowledge as an overreaction to normal life circumstances, rather than legitimate professional expertise. Even as I was completing advanced training in exactly the kind of treatment he was going to need, he continued to dismiss my clinical observations as personal neuroses. During my final semester of nurse practitioner school, I was offered a position at Millbrook Heights Recovery Center upon graduation. Dr. Caraway wanted me to join their outpatient clinic, where I would provide comprehensive care for patients transitioning from inpatient treatment back to their daily lives. The position would allow me to prescribe medications, order diagnostic tests, and develop treatment plans for some of the most complex cases in addiction medicine. Your clinical skills are exceptional, Dr. Caraway told me during our final evaluation meeting. More importantly, you have the kind of empathy and non-judgmental approach that these patients desperately need. Many of them have been dismissed or stigmatized by other healthcare providers. The job offer came with an impressive salary, excellent benefits, and the opportunity to work with cutting-edge treatment protocols. It was everything I had hoped for when I started my journey toward becoming a healthcare provider. I accepted the position immediately, but I didn't share the news with Adrian right away. His drinking had escalated to the point where he was rarely sober during evening hours, and our conversations had become increasingly hostile when the topic turned to anything health-related. Instead, I began preparing for the transition quietly. I researched apartments I could afford on my new salary, knowing that Adrian's behavior was becoming too disruptive for me to continue living with him. I also began documenting the signs and symptoms I was observing, not because I planned to confront him immediately, but because I suspected he would need comprehensive treatment sooner rather than later. The documentation proved prescient. 3 weeks before my graduation from nurse practitioner school, Adrian was arrested for driving under the influence after leaving a bar in downtown Millbrook Heights at 2 a.m. on a Tuesday night. His blood alcohol level was nearly 3 times the legal limit, and he had crashed his car into a parked vehicle, though fortunately no one was injured. I received a phone call from the police station at 4 a.m. Adrian had listed me as his emergency contact, and they were calling to inform me about his arrest and ask if I could arrange for his car to be towed from the accident scene. When I arrived at the station to pick him up after he was released on his own recognizance, Adrian was belligerent and defensive. "This is completely ridiculous," he said as we drove home in my car. "I wasn't even that drunk. The breathalyzer machine must have been malfunctioning. Adrian, you crashed into a parked car." I was tired. It could have happened to anyone. At 2 a.m. on a Tuesday, after drinking enough alcohol to register 3 times the legal limit. "You don't know what you're talking about, Naomi. Just because you're studying addiction doesn't make you an expert on my life." The statement was so ironic that I almost laughed. Adrian had no idea that I was about to become exactly the kind of expert he claimed I wasn't, specializing in exactly the kind of problem he was refusing to acknowledge. His DUI arrest triggered a series of consequences that forced him to confront the reality of his situation. His driver's license was suspended for 6 months. His insurance rates tripled. Most seriously, his employer initiated disciplinary action that could result in termination if he didn't complete court-mandated alcohol education classes. Adrian approached these requirements with the same dismissive attitude he had always used regarding health concerns. The alcohol education classes were a waste of time. The court-ordered evaluation was completely unnecessary. The suggestion that he might benefit from ongoing treatment was ridiculous overreach by the legal system. But the evaluation, conducted by a certified addiction counselor, reached conclusions that aligned perfectly with my own clinical observations. Adrian met the diagnostic criteria for alcohol use disorder, moderate severity. The counselor recommended intensive outpatient treatment, including individual therapy, group counseling, and ongoing monitoring. Adrian's response was predictably dismissive. "The whole system is designed to make money off people who have one bad night," he told me after receiving the evaluation results. "I don't have an alcohol problem. I made one mistake in judgment, and now everyone wants to treat me like I'm some kind of addict." The language was achingly familiar. It was the same dismissive tone he had used when talking about my chronic pain condition, the same refusal to acknowledge that professional healthcare providers might have valid insights into his situation. The difference was that this time, I was becoming one of those healthcare providers. I graduated from nurse practitioner school on a Saturday morning in May. Adrian attended the ceremony, sober because it was only 10 in the morning, and seemed genuinely proud of my academic achievement. He had no idea that my new credentials would soon make me qualified to provide exactly the kind of treatment he was refusing to accept. "I'm glad you found something you're passionate about," he said after the ceremony, "even if it's kind of depressing working with addicts all the time." "It's not depressing," I told him. "It's hopeful. These are people who can get better with proper treatment and support." "If they actually want to get better," Adrian replied. "Most of them probably just want drugs." The comment revealed so much about his fundamental misunderstanding of addiction as a medical condition rather than a moral failing. It also revealed how much he still had to learn about the very condition. He was struggling with himself. 2 weeks later, I started my new position at Millbrook Heights Recovery Center. My office was in the outpatient clinic, where I would be providing comprehensive care for patients who were working to maintain their sobriety while managing co-occurring medical conditions. Dr. Caraway introduced me to the treatment team as their new nurse practitioner specializing in dual diagnosis cases. "Naomi brings a unique combination of chronic pain expertise and addiction medicine training," she told the group. "She'll be particularly valuable for our patients whose substance use originated from legitimate medical needs." As I set up my office and reviewed my first week's patient schedule, I couldn't help but think about the irony of my situation. Adrian, who had spent years dismissing my medical expertise and sabotaging my health care, was struggling with exactly the kind of condition I was now qualified to treat. He had no idea that his little sister, whose medical appointments he had deleted as a waste of time, had become a healthcare provider specializing in the very problem he was refusing to acknowledge. But I suspected he was going to find out soon enough. His court-mandated treatment requirements were becoming more difficult to ignore, and his drinking was escalating despite the legal consequences he had already faced. The next time Adrian needed medical expertise, and I was increasingly certain that time was coming soon, he was going to discover that the sister whose health care he had sabotaged was now the kind of provider whose expertise he desperately needed. The phone call came at 2:30 on a Thursday afternoon, 6 months after I started working at Millbrook Heights Recovery Center. I was between patient appointments, reviewing lab results for a client whose liver function tests had shown concerning elevations, when my phone rang with a number I didn't recognize. "Is this Naomi Ferrow?" The voice was unfamiliar, professional, with an undertone of urgency that immediately put me on alert. "Yes, this is Naomi." This is Dr. Trenwick from Millbrook Heights Emergency Department. Your brother Adrian Vosler was brought in about an hour ago. He's stable, but we need to discuss his treatment options with a family member. My stomach dropped. What happened? Mr. Vosler was found unconscious in his apartment by his landlord, who had been called by his employer when he didn't show up for work for 3 consecutive days. His blood alcohol level on admission was dangerously high, and we're seeing signs of alcohol withdrawal syndrome. He's going to need comprehensive medical management. I closed my eyes, feeling a mixture of dread and inevitability. This was the call I had been expecting for months, ever since Adrian's drinking had escalated beyond any pretense of social consumption. "I'll be right there," I told Dr. Trenwick. "Actually, there's something else you should know." When we asked Mr. Vosler about his medical history and emergency contacts, he mentioned that his sister works in healthcare. He specifically asked if we could find someone who actually knows about this stuff to explain his treatment options. He seemed quite insistent that regular doctors wouldn't understand his situation. The irony was so sharp, it took my breath away. Adrian, who had spent years dismissing my medical expertise, was now asking for exactly the kind of specialized knowledge he had always claimed was unnecessary. I arrived at the emergency department 20 minutes later and was directed to bed 7 in the acute care unit. Adrian was awake, but looked terrible. Pale, shaky, with the kind of exhaustion that came from days of heavy drinking followed by abrupt cessation, he looked up when I approached his bed, and I saw a flicker of relief in his eyes. "Naomi, thank God. Can you talk to these doctors? They keep asking me questions about my drinking, but they don't understand that this isn't a normal situation. I just need something to help me feel better so I can get back to work." Dr. Trenwick appeared beside me, chart in hand. "Are you the sister who works in healthcare?" "Yes, I'm a nurse practitioner." "Excellent. Your brother is experiencing moderate alcohol withdrawal syndrome. His symptoms include tremors, anxiety, nausea, and elevated blood pressure. We need to discuss treatment options and the need for inpatient stabilization." Adrian looked between us with growing confusion. "Wait, what kind of nurse practitioner?" "I specialize in addiction medicine and dual diagnosis treatment," I said quietly. The color drained from Adrian's face as the implication hit him. His little sister, whose medical appointments he had deleted as unnecessary, whose chronic pain condition he had dismissed as psychological, whose healthcare expertise he had consistently undermined, was now a specialist in exactly the condition he was struggling with. "You treat addiction?" he asked, his voice barely above a whisper. "That's my primary specialty. Yes." Dr. Trenwick continued with his medical recommendations, but I could see that Adrian was no longer listening. He was staring at me with a mixture of shock, embarrassment, and dawning realization. "Mr. Vosler, your sister's expertise is actually quite fortunate," Dr. Trenwick said. "Addiction medicine is a highly specialized field, and having family support from someone who understands the medical complexities will be very beneficial for your recovery. After Dr. Trenwick left to arrange for Adrian's admission to the medical unit, we sat in silence for several minutes. The beeping of monitors and distant conversations between medical staff filled the space between us. "How long have you been doing this?" Adrian finally asked. "I've been working in addiction medicine for 6 months. I completed my nurse practitioner degree last year. While you were living with me." "Yes, and I never knew. You never asked. When I mentioned taking classes and working at the hospital, you assumed I was moving away from healthcare concerns rather than diving deeper into them." Adrian closed his eyes. "The night I got arrested, when you said you were studying addiction, and I told you that didn't make you an expert on my life. You were wrong about that. I was wrong about a lot of things." He looked at me with an expression I had never seen before. Genuine humility mixed with fear. "Naomi, I need help. Real help. This isn't just about the DUI or the court requirements anymore. I can't stop drinking, and it's destroying everything." It was the first time Adrian had ever acknowledged having a medical problem that required professional intervention. It was the first time he had asked for my help, rather than dismissing my concerns. The good news is that alcohol use disorder is very treatable when patients are committed to recovery, I said, slipping into my professional mode. You'll need medical detoxification first, which means staying in the hospital for several days while we manage your withdrawal symptoms safely. After that, you'll need intensive outpatient treatment. Will you be my provider? The question caught me off guard. Adrian, I don't think that would be appropriate. Family members treating each other can create boundary issues that interfere with effective care. But you understand this condition better than anyone else I could see. There are several excellent providers in this field. Dr. Caraway, my supervisor, specializes in cases exactly like yours. She has 20 years of experience and excellent outcomes with her patients. Adrian nodded slowly. Will you at least help me understand what's happening? All of this medical stuff is overwhelming. It was another ironic moment. Adrian, who had always prided himself on being the knowledgeable, capable sibling, was now asking me to help him navigate exactly the kind of complex medical situation he had always dismissed as unnecessary when I was dealing with chronic pain. Of course, I'll help you understand your treatment options, I said. But Adrian, you need to be prepared for this to be a long process. Recovery from alcohol use disorder isn't just about stopping drinking. It requires changes in thinking patterns, lifestyle modifications, ongoing therapy, and sometimes medication management. It's exactly the kind of comprehensive medical treatment you use to criticize me for pursuing. I know, he said quietly. I was wrong about that too. When you were dealing with your chronic pain, you were trying to get the kind of specialized, comprehensive care that I'm going to need now. Yes, you were wrong. You deleted my medical appointments because you thought I was wasting time and money on unnecessary health care. Now, you're facing a condition that requires exactly the kind of ongoing medical management you used to dismiss. Adrian was quiet for a long time, processing the full scope of the role reversal that had occurred. I'm sorry, he said finally. I'm sorry for sabotaging your health care. I'm sorry for dismissing your medical needs. I'm sorry for thinking I knew better than you did about your own condition. The apology felt genuine, but it was also long overdue and motivated by his current crisis, rather than any real understanding of how his actions had affected me. Thank you for apologizing, I said, but right now the most important thing is getting you the treatment you need. Dr. Trenwick returned with admission paperwork and a treatment plan that included medical detoxification, psychiatric evaluation, and referral to intensive outpatient programming upon discharge. As I helped Adrian understand each component of his treatment plan, I couldn't help but reflect on how completely our roles had reversed. The brother who had once dismissed my medical expertise was now dependent on exactly that expertise to understand his own healthcare needs. The sister whose medical appointments he had deleted as unnecessary was now explaining why each component of his treatment was medically essential. For the first time in our relationship, Adrian was listening to my medical recommendations with respect and attention rather than dismissal and skepticism. It had taken a medical crisis and the threat of losing everything for him to recognize that maybe, just maybe, I had known what I was talking about all along. 18 months later, I stood on the stage of the Millbrook Heights Convention Center, holding the Regional Healthcare Excellence Award for Innovative Treatment Approaches. The auditorium was filled with healthcare providers, administrators, and community leaders who had gathered for the annual Medical Professional Recognition Ceremony. The award recognized my development of an integrated treatment protocol for patients with co-occurring chronic pain and substance use disorders. My research had shown that traditional addiction treatment programs often failed patients whose substance use had originated from legitimate medical needs, while pain management clinics frequently dismissed patients with any history of addiction. My protocol addressed both conditions simultaneously, resulting in significantly better outcomes for this challenging patient population. Dr. Ferrow has revolutionized treatment for some of our most vulnerable patients, announced Dr. Caraway, as she presented the award. Her integrated approach has achieved a 73% success rate in maintaining both pain management and sobriety, compared to the 32% success rate of traditional separate treatment models. As I accepted the Crystal Award and approached the microphone, I could see familiar faces in the audience. My colleagues from the Recovery Center, professors from my graduate program, and in the third row, sitting next to our parents, was Adrian. He had completed his inpatient detoxification program and had been sober for 16 months. His recovery had been challenging, marked by several near relapses and ongoing struggles with the lifestyle changes required to maintain sobriety. But he had followed through with every aspect of his treatment plan, attended all his therapy sessions, and gradually rebuilt the life his addiction had nearly destroyed. Most importantly for our relationship, his recovery had included making amends for his past behavior, including a genuine acknowledgement of how his dismissal and sabotage of my healthcare had affected me. When I first started working in addiction medicine, I began, looking out at the audience. I thought I was choosing this specialty because of my personal experience with chronic pain. I believed that understanding what it meant to need medical care would make me a better provider for patients dealing with substance use disorders. I paused, making eye contact with Adrian, who was listening intently. What I didn't realize at the time was that I had also learned something equally valuable from having my medical needs dismissed and undermined. I had learned what it felt like to have healthcare providers, family members, and society question the legitimacy of my condition. I knew what it meant to be seen as drug-seeking, attention-seeking, or simply too weak to handle normal life stresses. The audience was silent, focused on every word. Many of our patients with substance use disorders have had similar experiences. They've been dismissed by healthcare systems, judged by family members, and stigmatized by society. They come to us, expecting to be treated as moral failures rather than people with medical conditions that require comprehensive care. I thought about the dozens of patients I had worked with over the past 2 years, people whose stories of medical dismissal and family rejection sounded achingly familiar to my own experience. The most powerful tool we have as healthcare providers isn't our prescriptive authority or our diagnostic skills. It's our ability to see patients as complete human beings whose experiences are valid and whose recovery is possible. When we approach treatment with curiosity rather than judgment, with collaboration rather than condescension, we give patients something many of them have never received: hope. I glanced at Adrian again, remembering the fear in his eyes that day in the emergency department when he finally acknowledged that he needed help. People often ask me what motivates me to work in addiction medicine, given the high rates of relapse and the complexity of these cases. The answer is simple: silence taught me to speak. When no one believed my reports of chronic pain, I learned to document everything. When my medical needs were dismissed as unnecessary, I became determined to master medical knowledge. When my healthcare was sabotaged, I decided to become the kind of provider I had always needed. The audience was completely engaged, and I could see several people nodding in recognition. Every patient who has been told their pain isn't real, every person whose addiction has been dismissed as a character flaw, every individual whose medical needs have been minimized or ignored, they all have the potential to transform that experience into expertise, advocacy, and healing. I held up the award, its crystal surface catching the stage lights. This recognition isn't just for me. It's for every patient who has been dismissed and every healthcare provider who chooses to listen instead of judge. It's for every family member who has learned to support rather than sabotage their loved one's medical care. The applause was thunderous. As I stepped down from the stage, colleagues approached to congratulate me. Patients from my clinic beamed with pride, and professors from my graduate program expressed their satisfaction with my professional development. But the moment that meant the most came when Adrian approached me near the exit of the convention center. "I'm proud of you," he said, and for the first time in our relationship, I could hear genuine respect in his voice. "What you've built here, what you've accomplished, it's incredible." "Thank you," I replied simply. "I need you to know that I understand now what I did to you," he continued. "When I deleted your medical appointments, when I dismissed your pain condition, when I told you that seeking medical care was a waste of time, I was wrong about everything. I know you understand that now. But I also need you to know that watching you work with my treatment team, seeing how you've helped other patients who were struggling like I was, it made me realize something else. You didn't just become a good healthcare provider despite what I did to you. You became an exceptional healthcare provider because of what you learned from being dismissed and undermined." I nodded, appreciating his insight. "The patients you work with, they trust you in ways they don't trust other providers because you've been where they are. You know what it means to have your medical needs questioned and your pain dismissed. That experience made you someone who could help people like me when we finally admitted we needed help." As we walked toward the parking garage together, I reflected on the journey that had brought us to this point. Adrian was right. My experience of medical dismissal and healthcare sabotage had ultimately made me a better provider. But more than that, it had taught me something essential about resilience, determination, and the power of turning pain into purpose. "You know what the best part is?" I said as we reached my car. "What's that?" "I don't need anyone's permission anymore to be taken seriously as a healthcare provider. I don't need anyone's validation to know that my medical expertise is valuable. I built this career not because someone believed in me, but because I believed in myself enough to keep going when no one else did." Adrian smiled, the first genuine smile I had seen from him in years. "The girl whose medical appointments I deleted," he said slowly, "turned out to be exactly the kind of expert I needed when I finally admitted I had a medical problem." "Yes," I agreed. "She did." As I drove home that evening, the award on my passenger seat catching streetlight reflections, I thought about all the patients I would see the following week. People whose pain had been dismissed, whose addiction had been stigmatized, whose medical needs had been minimized by families and providers who didn't understand the complexity of their conditions. They would walk into my office expecting to be judged, questioned, or dismissed. Instead, they would find someone who understood their experience from the inside, someone who had transformed her own medical dismissal into the expertise they needed. I had learned to turn silence into strategy, dismissal into determination, and sabotage into success. And now, every day, I got to help other people do the same. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.